Often, no one knows why a woman doesn't get pregnant. The odds of naturally becoming pregnant are far from 100%. For a healthy young woman on any given month, the odds are actually only about 25%.
It's a very inefficient process. We land up with a lot of eggs most of the time, but there's an attrition continuously. Not all eggs are good eggs. Not all eggs are mature. Not all eggs fertilize. Not all embryos divide. Not all embryos implant. And most patients don't have enough to cryopreserve.
We did ICSI, and we ended up with a good dozen embryos with each cycle. And we ended up with a lot of embryos that went to blastocyst.
And the dilemma was, at this point, how many embryos do you transfer?
Each time we're faced with that decision. How many do you want to put in? If we put 3 in, would you be willing to carry triplets? If you're not willing to carry triplets, are you okay with selective reduction? And there are all these huge philosophical, moral issues that arose that you'd have to decide on a dime.
And it's a balance. And the balance is between success, achieving a pregnancy, and multiple pregnancies, which is not always a success.
The embryologist would come and talk to you. You'd be in a gown and you'd have that lovely gauzy hat on, and you'd have to decide, okay, well, do I only put 1 in because I don't want to make the decision to selectively reduce? But did I just go through that month of torture for just, a minimized chance of success?
You have a consumer who wants a baby. A lot of them have been through many years of infertility. It's been draining economically, emotionally. This patient is looking at pregnancy. On the other hand, we need to look at healthy outcome. And a healthy outcome is not triplets. And so that's the fine balance we struggle with every day.
What strikes me is these are decisions that human beings never had to make before. And all of a sudden, in the last 10, 15, 20 years, we have been given so much control over these previously mysterious and invisible processes. And it's hard.